Kidney transplant procedure for the recipient. What are the kidney transplant requirements? Each hospital has its own criteria for accepting people as kidney transplant recipients, but in general, candidates for kidney transplant should have end-stage renal failure and beyond dialysis chronic kidney disease with a glomerular filtration rate, GFR, less than or equal to 20 milliliters per minute. A full understanding of postoperative instructions and care. Be in good overall physical and mental health with strong social support. What disqualifies you from getting a kidney transplant? Kidney transplants are approved on a case-by-case basis, but there are some general factors that could make a person ineligible for a kidney transplant, such as a serious health condition, certain infections, cancer, or history of cancer, certain mental health conditions, poor social support, a short life expectancy, history of non-compliance with medications and treatment. No matter what your situation, your healthcare provider can determine whether a kidney transplant is a safe treatment option. What happens during a kidney transplant procedure? Kidney transplantation involves placing a healthy kidney into your body, where it can perform all of the functions that a failing kidney can't. Your new kidney is placed on the lower right or left side of your abdomen, where it's surgically connected to nearby blood vessels. Placing the kidney in this position allows it to be easily connected to blood vessels and your bladder. The vein and artery of your new kidney are attached to your vein and artery. The new kidney's ureter is attached to your bladder to allow urine to pass out of your body. What happens to my old kidneys? In most cases, your surgeon will leave your damaged kidneys inside your body. Rarely, people with a history of polycystic kidney disease will have their damaged kidneys removed. How long is kidney transplant surgery? On average, kidney transplant surgery takes 4 to 6 hours to complete. What happens after a kidney transplant? Most people spend about 10 days in the hospital after a kidney transplant. This way, your medical team can keep a close eye on you and make sure you're recovering well. Your new transplanted kidney may start working immediately, or you may need dialysis temporarily until it starts working. This might take several days or weeks. You'll also need to start taking immunosuppressants medications to keep your immune system from rejecting your new transplanted kidney. What are the benefits of a kidney transplant? A successful kidney transplant gives you increased strength, stamina, and energy. After transplantation, you should be able to return to a more typical lifestyle and have more control over your daily living. You can have unrestricted food and fluid intake. If you were dependent on dialysis before the transplant, you'll have more freedom because you won't be bound to your dialysis schedules. Anemia, a common problem with kidney failure, might be corrected after transplantation. If you have high blood pressure, you could be on fewer blood pressure medications after transplantation. What are the risks of kidney transplants? The risks of kidney transplantation include those of any surgery. There's a risk of bleeding, infection, or other surgical complications. You also might experience some side effects from the medications, and you could be more prone to infections and certain cancers since the medicine you'll take after transplantation lowers your body's immune system. Kidney transplant rejection. Since your body recognizes the new kidney as a foreign object, it'll try to get rid of it or reject it. But you'll be given medicine to prevent rejection. Because of years of experience, research, and improved medicines that prevent rejection, kidney transplants are very successful, with few complications after transplantation. What is the recovery time after a kidney transplant? On average, kidney transplant recovery time is about 6 weeks. This timeline is different for everyone, though. It depends on your overall health and other factors. How can I take care of myself during recovery? Follow your healthcare provider's instructions as restrictions vary. General guidelines include: avoid heavy lifting for at least 8 weeks. Ask your surgeon about safe activities. Avoid driving for at least 6 weeks. Arrange for help in advance. Avoid contact sports to protect your transplanted kidney. Consult your provider if unsure. Are there foods to avoid after a kidney transplant? Yes. Follow these guidelines. Stay hydrated. Drink about 2 liters, 68 ounces, of water daily, and limit caffeine. Avoid raw or undercooked foods. They increase the risk of infection. Eat plenty of protein. It helps rebuild muscle and recover weight. Avoid grapefruit and its juice. They interact with transplant medications. Avoid NSAIDs, ibuprofen, naproxen. They may harm your kidneys. Check with your provider about other over-the-counter medications. Can you live a normal life with a kidney transplant? Yes, many people live healthy, fulfilling lives after a kidney transplant. The 1-year survival rate is 95%, and the 3 to 5-year rate is 90%. Survival rates are estimates and vary by individual. Talk to your healthcare provider for more details. When should I contact my healthcare provider? After your kidney transplant, regular follow-ups are essential. However, contact your healthcare provider immediately if you experience fever of 100 degrees Fahrenheit or 37 degrees Celsius or higher, new pain or tenderness near your kidney swelling, edema, flu-like symptoms, chills, headaches, dizziness, nausea, or vomiting, decreased urine output, any new or unusual symptoms. You will need to take immune suppressant medicines to reduce the risk of kidney rejection. The doses of these medicines usually reduce over time, but some immunosuppressant medicines will be needed for the lifetime of the kidney transplant. If you have chronic kidney disease or end-stage renal failure, a kidney transplant can eliminate the need for dialysis and give you a fresh beginning. It may feel scary, knowing you're having a life-changing surgery. Try to take comfort in the fact that kidney transplantation is usually successful. Rely on your healthcare team and trust that you're in great hands.